Welcome to the 8th annual PhD conference. Excellent. Well, thank you all for being here, but to bring us in this morning, it's a real pleasure to bring on stage our Chair of Trustees, who has been a real cornerstone for our development in the past couple of years, and over the past year since he's taken on the role. And just to kind of give you a bit of background on him, before founding his healthcare software company Black Pear, Dr. Jehring had a 20-year career as an NHS family doctor, where he went on to design the first Windows GP clinical system in the UK. So all the GPs out there can thank David for that. And so without further ado, please welcome to the stage Chair of Trustees of the Public Health Collaboration, Dr. David Jehring.
Good morning, Croydon. And welcome. It's amazing to see so many people here. We've got 500 of you, which would not be possible without the amazing work of Olivia. So I think a big round of applause for Olivia. We are, as you're probably aware, a not-for-profit charity. Everything that we do is done by volunteers. So I think all of our volunteers are amazing ambassadors, our health coaches. Again, give them a real round of applause. What are we here to do? Well, what we're here to do is to empower, inspire, and educate. And who are we aimed at? Well, we're aimed at you, the public, and also healthcare professionals. We need to work together to solve this massive problem of metabolic ill health that has developed in my professional career. And what are we about? We're about educating about metabolic health and the power of eating real food. We don't care whether you're a vegan, a vegetarian, a carnivore, whatever you eat, we're here to help you and teach you about real food. And our vision is to end with a society where everybody enjoys good metabolic health. We're a grassroots movement, so we aim to talk to everybody and actually through the power of networking to build a movement so that everyone understands that improving your metabolic health is not only easy, but it's possible for everybody. We've got loads of free resources. We've got nutritional advice and content on our website. We've got the great David Unwin's sugar infographics. We've got information about what real food is. And we've got information about where you can find GPs that will help you with your lifestyle. We've got some amazing stuff on YouTube. We've got a free 8-week course for everyone who's unfamiliar with how to improve their metabolic health to learn. And we've also got all of the amazing talks over the last 8 years from our speakers, like Robert Lustig, who I saw yesterday, who gave an amazing talk 5 years ago. They're all there for you to look at. So our goal is to, firstly, reverse type 2 diabetes. And there's a certain urgency to this. So it's a growing epidemic. Cases of type 2 diabetes have doubled in the last 15 years. So as part of my work as chief nerd in the world of NHS informatics, I wrote the first national diabetic audit, because we had our software in every practice in the land, in 2000. And since then, the prevalence has just gone through the roof. I mean, the first practice we did an analysis on, we found 120 diabetics, which I thought was amazing. But in fact, since then, we now have 1 million diabetics who are undiagnosed, which is just shocking. So there are now 4.1 million people in the UK who are currently living with diagnosis of diabetes, and about 90% of these cases are type 2. I mean, it's just shocking. And as I've just said, there are almost 1 million undiagnosed, and it's just getting worse and worse. So by 2030, it's estimated that 1 in 10 UK adults could have diabetes. So how are we helping to address this? We have our amazing lifestyle club run by Helen Gowers, who you'll be hearing from later. And the program, which is based on the work of David Unwin, is 8 sessions of 90 minutes, and we're getting really good results. And particularly in terms of weight loss and improving HbA1c, and providing a supportive environment for people not only to be helped by our health coaches, but to network and to help each other. And I'm amazed to say that we got Quizmet accreditation last year, and we got a Silver Winner Award, Primary Care Project of the Year. So again, a great round of applause for Helen. And our study that we announced last year, partnering with practices in Surrey for diabetes remission, I was privileged enough to talk to the Integrated Care Board in Surrey a few weeks ago, and the practices there have produced about 50 patients for us, so a big thank you to them, and we're going to prove that this stuff works with this study. So the next goal is to get food addiction recognised as a diagnosis. I know a number of you were at the food addiction conference yesterday, run by the amazing Jen Unwin, but we also have our programme within the PHC run by the great Ellen Calto, who is helping basically liberate people from obsessive eating, which for those of you who suffer from it will know someone who does. It's just tragic that they're hooked on these ultra-processed foods. So Liberate is growing, and we're getting great results from our initial trials. And finally, we need to undo the childhood obesity epidemic that is driving this pandemic of metabolic ill health. And in order to drive that, we have the Real Food Rebellion, which is a school-based project, and again, we're getting great inroads there. So how can you help? Well, first of all, continue to spread the word. Clearly, with 500 people here this year, it's working really well. Follow us on Facebook or Instagram and Twitter. Go to our website, become a member, become an ambassador if you've got the time, and fundraise if you can. And on Monday, we have a workshop for those of you who want to stay on, so we'd love to see large numbers of you there. So yes, enjoy the conference. Come and talk to me if you want to, if you've got any ideas, and let me hand back to the amazing Sam Feltham.